student here at the College of Nursing, and today I will be performing a central line dressing check. So first what I'm going to start off by doing is verifying my orders, checking my hospital policy. I'm going to gather my equipment and perform hand hygiene. Now I'm going to check my patient using two identifiers. So we have Jaguar Jones, and my number is 417-6352, 417-6352, and they are allergic to penicillin. So now I'm going to explain the procedure to my patient and pull a curtain for privacy. Now what I'll do is I'll assess the insertion site and palpate it, and then I will look for any indications needing a culture, which would be signs of infection. So if there's any redness or pus drainage, then I would obtain a culture if the healthcare provider ordered it. Okay, so now I'm going to position the bedside table close to the central line, and I'm going to make sure that it's above waist level. And then I'm going to position my trash can, perform hand hygiene, and raise my patient's bed to a working height, lower their side rails, place their head into a comfortable position with the head slightly elevated. Now I'm going to remove the kit from its plastic container, open the one flap, get my patient's mask, don my patient's mask. Now I'm going to don my mask, put on my goggles. So I'm going to remove my mask just for the sake of the video so my goggles don't fog up and so you can hear me. So now I'm going to don my gloves, and I'm going to remove the dressing. I'm removing the tegaderm from the outside going inward while stabilizing the catheter. And we're going from the outside into the center of the catheter, removing the outside on both edges, and then removing the center. Okay. So I'm going to ball it up into my hand, and I'm just going to assess. I'm not going to touch the site in any way. I'm just assessing it. So now I'm going to ball it up in my hand, and this would be the time that I would collect that culture if it was needed. So now I'm going to remove my gloves, throw them away, and perform hand hygiene. Now I will finish opening my kit, making sure to only touch the 1-inch border. Okay, and now I'm going to don my sterile gloves. Sterile gloves on. I can touch glove to glove to fix them. Okay, so now that is fixed, I would rearrange the items in my thing, but I'm just going to leave them how they are. They're in a good position. So now we're going to clean the site. So first I'm going to start off with my alcohol swab. I'm going to start from the inside of the site and go outwards, making sure not to touch back on what I previously did. Okay, I'm going to drop that to the trash bin. Now I'm going to get my For prep, you're going to crack it open by squishing that, and then we're going to scrub vigorously for 30 seconds. So all over, around. I'm going to hold with this hand to stabilize the catheter. So this hand's now contaminated. I'm just going all around, up under it. Okay, now we'll do that for 30 seconds and let that dry. Once that is dry, I'm going to take I want to note that by doing that, I would have contaminated this hand, so I would have completely started over and got new gloves. I will not touch anything with this hand because this hand is contaminated. I'm going to pick up my bio patch without touching the center of it and place it down. It will go down and around the insertion site. It will go up in between and around the catheter, but my shoelace is kind of taped right there, so it doesn't move out, so it's kind of just sitting on top, but normally it would go around the catheter. So now I'm going to get my tegaderm. Even though this hand is contaminated, I'm not touching the sterile part of the tegaderm. I'm going to place my tegaderm in the center, or place the central line in the center of the tegaderm. Make sure it is smoothed down. And now I'm going to remove the edges while smoothing it down. So now, once that is done, I'm going to clean up my area. Remove my gloves. Okay, I'll perform hand hygiene, remove my patient's mask, remove my mask, and I will remove my goggles. And now I'm going to date my label, so I'm going to put first, today's date is 11/16, time is 10:30 in the morning, and I'm going to date CK for Shane Kelly, my initials. I'm going to place it on the outside edge of my dressing. So now I'm going to throw that away. I will raise my patient's bed. I will lower my patient's bed, raise their side rails, place them in a comfortable position, give them their call light, perform hand hygiene, then I'm going to document. I'm going to document the date and the time that I performed this. I will document how my patient took the procedure. I'll document the characteristics of the outside of the insertion site. So I'm going to document any discharge, the color, consistency, and characteristics of it, the amount of it. I'll document if I took a culture, if that was indicated. I'll document what kind of dressing I put on it, what kind of cleanser I used for it, and then I'm going to date it, time it, and sign it.